Welcome to the 5 on 5. We are pleased to be joined today by Susan Fischer, Health and Education Integration Manager at All Care Health. Susan, thanks for being here with us today.
My pleasure. Thanks for having me.
Let's get started with a little background of what you do.
Absolutely. So my background is as a teacher, but All Care Health as a coordinated care organization is really focused on healthcare transformation, which means we view individuals for their whole being. So we want to take care of their physical health, their oral health, their behavioral health, but we also are thinking about their social determinants of health. So my role is to connect what's taking place in healthcare transformation with what's going on in our schools and our family support systems.
Okay, and now what does that mean when you talk about whole person, the community they live in?
Yeah,
what does
absolutely.
that look like?
You got it. So social determinants of health really are the things that surround you. So they're the neighborhood that you live in. They're the quality of food that you have to eat. They're your experience of education or community supports. And what we know is that almost 90% of health outcomes are related to social determinants of health.
Okay. Now list some ways that you're addressing some of those with your members.
Yeah, absolutely. So we do many different programs, my focus being on education and family supports. What we're looking at is supporting schools and early childhood programs to enhance children's readiness for school and ultimate success, as well as once they get into school, ensuring that they're healthy so that they can be in the classroom each day.
We've got much more to talk about, but we're going to take a quick break. We'll be right back. Welcome back. We are pleased to be joined once again by Susan Fischer, Health and Education Integration Manager at All Care Health. Susan, thanks again for being here with us.
An absolute pleasure. Thank you.
We're talking about some of the programs that you guys are implementing for members. Let's talk about back to school.
Yeah.
It's just around the corner. Big to-do list probably for some parents. What is your advice to parents who are maybe facing some anxieties about going back to school? Maybe their kids are just starting school.
Absolutely. So the beautiful thing is that in our community, we're rallying around what's called developmental screening. Developmental screens, the one that's used most frequently in Oregon, is called the Ages and Stages Questionnaire. Sometimes we abbreviate it ASQ. And the Ages and Stages Questionnaire is designed for parents to fill out. It covers 5 areas of development. And through those domains, we can look and see where we can celebrate our children's growth, but also they can highlight areas where extra support might be needed.
Okay. Now, talk a little bit more about how those screenings work.
Absolutely. So one of the easiest ways to access a developmental screen is by going to your child's well visit exam. Most of our primary care physicians are using developmental screens. It's a recommended practice. However, we also see these screens being used in early childhood environments, home visiting programs, and parents can actually access the screen anytime for free through asqoregon.com.
And when they go to that website, what does that all look like?
You got it. So it can take anywhere from 10 to 15 minutes. And what it is you log on, you provide some brief demographic information, nothing that identifies your child, but it'll ask you questions about the way that they communicate. What are their skills with their fine or gross motor capacities? What's going on with them with their ability to self-regulate, to calm themselves down, or to pay attention in different situations? And from that, what we get is you get instantaneously a set of results showing where your child is really thriving, and if there are any areas of concern, they provide you with information about follow-up next steps. And in general, what that looks like is really communicating with your primary care physician or reaching out to the early intervention, early childhood special education office in your community.
So this is something you could do with your doctor or at home online.
Absolutely. And there is no danger in doing a screen multiple times. In fact, in our family, we just redid our 4-year-old son's developmental screen last night, and it really gave us an opportunity to think about, wow, look at how much he's grown. And then at the end with our results, we also received activities to enhance each of those 5 developmental domains that now we have, and as a family, we can support our son with those.
Very cool. Where can our viewers get more information about all of the things that we've been talking about today?
Absolutely. So you can go to asqoregon.com, and that's where you can access not only the Ages and Stages Questionnaire, but one that's really parallel that looks specifically at your child's social emotional growth, which we, as we listen to schools, know can really influence their success.
Susan, thanks so much for being here.
You're welcome. Thank you.
We'll be right back.